Most cases of HPV-related throat cancer involve male patients. However, the disease does not discriminate, and women can get HPV throat cancer too. That's what happened to Sandy Wexler of Houston, Texas. Here's her story. You went to go see the dentist on a routine visit, and that's when you found out there was a problem. What happened?
That's correct. I see my dentist every 3 months for routine cleanings. And in July of 2012, when I went for a routine cleaning, and the assistant did the cleaning, and then my dentist came in afterwards and checked my inside of my mouth and the outside of my mouth, and she kept feeling, and she said that I had an enlarged lymph node on the right side and I needed to get it checked out. And the irony is I'm a nurse, so you would think I would find something like that.
Had you noticed it before?
I was surprised that I hadn't seen it.
So you went to an ear, nose, and throat or a head and neck specialist?
That's correct. I went to ENT and they did a biopsy and the lymph node was metastatic squamous cell carcinoma.
What was your reaction to that diagnosis?
I was shocked. I mean, again, being a nurse and mostly with pediatrics, we have kids come in with viral infections all the time, and they have enlarged lymph nodes, so we don't really think much of it. So I was honestly thinking I probably just had a viral infection, and I didn't realize it. And they were going to give me antibiotics, and I was going to go home.
Can you tell me about the treatment and what it was like for you?
They sent me over to MD Anderson, and we started with infusion of the chemo, and I had a weekly infusion for 7 weeks, and 6 weeks of Monday through Friday proton therapy, which was a form of radiation. Initially, it doesn't seem to affect you as much as the accumulation with the radiation. As you go on and on, you become very fatigued, and eventually my skin broke down on my neck, so it looked terrible, and it hurt. It felt terrible. I was on a lot of medication. Mouth became very sore and throat very sore. I couldn't hardly swallow. I was on boost for about 3 months. I did lose about 10% of my body weight.
How are you doing now? It's been a few years. You feeling well?
I have residual dry mouth, so I'll take a bite of food and then I have to take a sip of water. It's just something that does affect your daily life. I do have decreased taste from the radiation. It probably it did zap the salivary glands for the dry mouth, and it obviously affected some of the tongue. The only thing I have any taste is if something is highly seasoned. If I'm eating a slice of pizza, I typically add the red pepper. I can't always tell you what I'm eating, but at least I can taste something.
Why are you speaking out now? What do you want people to know, and what have you learned?
I want to be an advocate for dentists and pediatricians and schools, and be an advocate and a voice for our children to make sure they get the HPV vaccine so that they don't have to go through what I've been through. I wish that it would have been around when I was growing up.
What do you think are the biggest misconceptions about the vaccine, and what do parents need to know?
I think the misconception is because it is a sexually transmitted disease that parents associate it with sex. We're not advocating and saying that the children can go out and have sex. But at some point in time, these children will have sex, and why not be protected? I wish I could be in a room when a child, God forbid, grows up where the parent refuses this vaccine for whatever reason, and the child becomes an adult and has to go through what I've been through and asks, Mom, why did you not get me vaccinated?
Most of the HPV throat cancer cases are affecting men, but women obviously can get the same kind of cancer too. Do you have any specific message for women? Because they're also equally exposed to the HPV.
Most of the women think of HPV, and obviously we did too, as cervical cancer. And that's been in the past what the highest prevalence has been with HPV cancers is from the cervical cancer. But now we have been seeing an increase in oral pharyngeal cancers that are HPV positive. And it's same exposures, and women are just as at risk.
And lastly, I want to ask you about your radiation mask, because some people would say, don't ever want to see it again. But you did something special with yours. Can you explain what you did?
And you're right, most people did. They ask you at the end of radiation if you want your mask. It's a hard acrylic mold of your face and upper chest so that it holds your body down, your face tightly during radiation. And the majority of people tell the staff just to get rid of it, and they don't want to see it again. And I took mine. A friend of mine who saw it, who's kind of an artsy person, and he said he wanted to do something with it. He actually had it sprayed in a silver and mounted it on a black, I guess, like a velvet, and had it framed. It does not bother me. It was part of my life, and it was an important part of my life, and I still have effects from it, and it's okay.
Well, I wish you good health, and thank you so much for sharing your story with us.
Thank you.